there we go. So first of all, what is a pressure injury? It's a localized injury to the skin and or underlying tissue, usually over a bony prominence, and it's as a result of pressure or a combination of pressure and shear. And pressure injuries are staged according to their depth of damage to the tissue, and the stage 1 starts as a non-blanching reddened area here, and this is the most severe stage of pressure injuries, which is the stage 4, and that's down to either bone or tendon. Structures are damaged. There are a couple of temporary categories as well, which are the unstageable and suspected deep tissue, and they can lead to either generally a stage 2 to stage 4 pressure injury. So that just gives you an idea of what we're trying to prevent with encounters. So sorry for the pictures. So back in 2014, HQSC, ACC and the Ministry of Health engaged with KPMG, which is an external auditing company, to develop a proposition for investment in a national quality programme to reduce pressure injuries in New Zealand. And unfortunately, there wasn't a lot of data collected by hospitals, aged residential care in the community, so this was based on estimation. And they found that approximately 55,000 people in New Zealand per year developed a pressure injury. So obviously that indicated that some interventions needed to be put in place. Costings associated with that, the estimate was $68 million in 1 year. For the cost of treating people who acquire pressure injuries. This is just purely the medical costs, the inpatient costs, the dressings, nursing staff time. This didn't include the quality of life for the patients. Pressure injuries can be really debilitating. It can lead to sepsis and even death. There's extended length of stay within the hospital environment, in an acute environment, associated surgical procedures, increased nursing input around dressings, further equipment that's required to help reduce the pressure injuries. So it's a significant cost, not just financially, but also to the patient and the impact on their life. So with encounters, back in 2009, an annual prevalence audit took place within Counties Manukau, and this included Middlemore, Manukau Surgical Centre, Puckey, Franklin, and the Auckland Spinal Unit. So this programme is across all facilities, inpatient facilities. The annual audit took place, and it was found that 10.4% of patients had a hospital-acquired pressure injury. So from that information, we were able to identify areas that needed to be improved. So we put an improvement programme in place and rolled out risk assessments with associated bundles of care based on the risk. Also developed guidelines, policies. There's a patient information leaflet that's been developed as well, and that's actually now been adapted and used nationally. Patient story, which showed the impact on the patient and the family, which is actually really powerful. And if you want to view that, that's on the New Zealand Wound Care Society and Ministry of Health websites as well. We developed an e-learning package to upskill the nursing staff within counties as well to identify about pressure injuries and prevention of pressure injuries. And also a pressure injury equipment decision tree, which based on the risk assessment, you could do a selection of what equipment was required for those patients. Our most recent audit done last year, we've just done one in May, but we haven't quite got the analysis done yet. But back last year, we had 2.3% of hospital-acquired pressure injuries. And there's been a significant reduction in the stage 3 and 4 pressure injuries, which are the more severe pressure injuries. So that's what we've been doing within counties.
Okay, so the research and evaluation team helps with a cost analysis of the pressure injuries intervention. And so what we did, first of all, was find some data which showed the estimated cost of treating pressure injuries in the UK from 2004, and that sort of provided sufficient detail that we could use that as an estimate for the cost of pressure injuries in the DHB. So we did try to access data that showed the actual cost in the DHB, but it wasn't available at sufficient detail to be able to do that. So we took the 2004 figures and then we used this inflation calculator to come up with the equivalent cost in 2016 when we did the study. Then, so we took the numbers of patients with pressure injuries in the sample from the monthly audits of 5 patients per ward that were carried out in all the hospitals in Middlemore, and we calculated, we found how many people had pressure injuries. So we actually ended up collapsing stages 3, 4 and unstageable, and the reason for that was because there were reasonable numbers of stage 1 and 2 pressure injuries, there weren't many for stages 3, 4 and unstageable. So for example, in 2013 there were no stage 4 pressure injuries, and if you look at the costs from the previous slide, they're really expensive compared to the lower stages. So I'll show you the next slide. When we extrapolated the figures, a small change in the number of stage 4 pressure injuries made a big difference when we were estimating across the DHB. So I have to be really quick now. We took the total number of patients admitted to Counties Manukau Hospital, worked out the number of pressure injuries that there would be in total from that number based on the percentages from the audit. Then we used the costs from the slide I showed you before, multiplied those out and came up with a total cost across Counties Manukau hospitals for the pressure injuries. And basically this was what we found. Going from 2011, the cost of treating pressure injuries we estimated to be this, and in 2015 it was estimated to be this. So generally we said there's a downward trend. Certainly between 2011 and 2015 there's a big difference. And there was it went up in 2014 in comparison because I think there were a small number of, a slightly increased number of stage 2, 3 and 4 pressure injuries for that year. But generally we said, this suggests evidence that the intervention seems to have worked. Which is pretty much what I've said there. Our findings agree with background literature, which has showed similar things in terms of interventions for pressure injuries. And there were some lessons learned which Heather was going to do, but
is supported by the literature.
Yeah.
About standardising risk assessments and putting bundles of care.
Yeah.
And putting robust processes in place to reduce pressure injuries.
Okay, and then that's basically it. That we concluded that we published this paper in the New Zealand Medical Journal, and those were our references. Any questions?